Hey guys, this is Dr. LaViola with Dental Masters, and today I want to talk about front implants. And when we talk about placing an implant on a front tooth, it's more than just taking a screw and putting it in to replace the tooth. There's how much soft tissue is there, how much bone is there, and that's going to affect how tall the tooth is, how wide the tooth is. And when replacing a single central tooth or the one right in the middle, we have to make sure that they look almost identical in size, shape, width, height. And so that's what we're going to talk about here. You're going to see a series of procedures that we did on placing a temporary implant crown so that the patient could heal. We can get closer to that. So let's go ahead and we'll take a look. So this is his picture when he came in, the implant's healed. And as you can see, that space, it's a lot wider than the tooth next door and it's a lot taller. So we get started. I had the temporary crown that's made at the lab, and they made it to an ideal size, and we're going to do a variety of procedures to make that match. Right now, on the adjacent tooth, the one next door to it, there's some bonding. It's kind of miscolored, and it's also not wide enough. So we're removing the old bonding, cleaning it up. You can see me shaping it right now and really getting the width of the tooth where I want it. Polishing. And I'm going to go ahead and put the temporary, kind of look at it, see do I like it. I think I wanted to polish it a little bit more. Came back, did a little bit more, and now we've got the width down. Now we're at height. So the tooth next door had excess gum tissue. So you're seeing me use what's called an electrosurgery, which basically removes gum tissue without and cauterize at the same time. It allows me to get the exact shape of the tissue next door. So we did that, and we're getting the height where we want it. Next, tightening the implant in. This is a screw retained implant crown. The final will be a little bit different, but in this case we use a screw retained so there's no cement, and that's why there's a hole coming out the front. We're going to go ahead and put Teflon tape and close that hole up so no bacteria can get in. And the reason we do this is because when we're using a temporary to kind of get the tissue established and the height of the tooth, the width of the tooth, it's really hard to do that by cementing the tooth on. It's hard to push the tissue with cement. And also we don't want cement getting caught around the implant in this phase. Anyways, we filled the hole. I'm using some bonding here, covering up the hole so it really matches nicely. Kind of sculpting, painting a little bit, as you can see. As I'm doing it, I'm looking at the overall shape of the tooth and making sure that I like it. And it's going quite well. So the color's not exact, but it's pretty close. Harden the material, and now we're looking at the x-ray, checking the bone. Does everything look good? And it does. We've got a healthy implant. So now I'm measuring, and as you can see, the height of the teeth, they're about 10.5 millimeters. If we would not have done these procedures, you would have had a 11 millimeter tooth and a 9 millimeter tooth as far as height, and the width would have been really funny. So by doing these procedures, we get quite a result that's very natural just by adding 2 extra procedures while adding his temporary implant crown, so that when we come back and we're ready for the final and we can change the color a little bit, it's going to look so much more natural. So these little details, they really, really matter. The gum tissue is going to heal up nicely, but looks really quite nice. So again, when we're talking about implants, it's not just about how many implants has a dentist placed or how do we put a screw in place. It's all the other surrounding things that go into it. How much bone is there? How much tissue is there? Is the tissue height correct? Is the width or the symmetry of the teeth correct? If not, that's why sometimes if you go one place and have an implant placed and another one and they put the crown and the 2 doctors are not communicating, or if someone doesn't have the knowledge or the tools under in their belt to do these things, you might get a tooth that looks a little funny. And it only took 2 extra procedures to make an enormous difference in Kendrick's smile with those 2 teeth. So when I showed it to him, I said, "What do you think?" He said, "Great," and was really, really happy. He was at first concerned that we would either have to leave the space that he used to have, which I think he would have been happier with, or when I showed him what it would have looked like with the wide tooth, that wasn't going to be acceptable. So bottom line, it's all in the details.